Hi, I'm your host, Marsha Florence for Just Ask. Today's show, ladies and gentlemen, is Just Ask the Doctor. We'll be right back.
Hey, Hard, what's this?
That's my resignation. You're resigning.
Why? You've been putting me under a lot of pressure lately. That's why I'm ready to quit.
Oh, I forgot. I'll do better. Please don't quit on me.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Hi, I'm your host, Marsha Florence for Just Ask. Today's show, ladies and gentlemen, is Just Ask the Doctor, and we have a returning physician with us today, Dr. Cynthia Shelby-Lane. Good morning, Dr. Lane.
Hello, Marsha.
Glad to have you back.
Thank you. Thank you for having me back. I told you I would come back.
You know what? Even if you did tell me you were coming back, there were some viewers that saying, "Is she coming back?"
Yeah.
So
Right.
we had to have you coming back.
Okay. All right.
Okay.
Good.
Now, I want to do a recap of your visit the first time because basically what we were talking about was medical marijuana. So let's go over what we talked about before, bring the audience
Okay.
up to speed.
All right. So I'm a physician, and I certify patients for marijuana usage, state of Michigan, recommendations only, not a prescription. And been doing pretty well in that arena in terms of just seeing what patients are doing, what patients are coming, what people need, how marijuana is changing their lives, like some before and after stories that are really great. We won't talk about that today. But just keeping up with the legislation in the state of Michigan is what I've been doing as well, and looking at the national forefront with the new administration.
Okay. So, today I wanted to get into it more like how does one educate themselves about not only just the proper use, but even trying to get a relationship with a physician such as yourself, and to receive, people think it's a prescription. I keep telling people, I say, oh, no, it's not a prescription.
Right.
Okay, that's a referral, but it's not a prescription.
Yeah.
So can you give us a little update on, how to educate oneself?
Okay, so the process in a nutshell is you have to have a recommendation from a physician for a medically qualified entity for medical marijuana use. It's a recommendation. So I say, you have a condition, you tell me what your problems are. It's a bona fide physician-patient relationship. You tell me what your problems are. I see if it fits under the guidelines for this state of Michigan. It's one of 28 states that are, medical, and I think there's recreational in Washington, D.C. But once that recommendation is established and you qualify, then at that point you're ready to start purchasing. And that's where you need to figure out, well, what am I going to do? What do I purchase? What forms of marijuana am I going to use? And so now you're a consumer, a patient consumer, making a decision about what to do for your condition. And so that's probably where people may need to do a little research on their own before they even come into a dispensary.
But a lot of times, and I think because it's on the table so hard, and when I say it's so hard, it's like, first of all, we were taking pills for every ailment there was, okay? And some people have relied on pain medicine to the extent that they can't get off now. So you went from the condition of the body injury, whatever that was, to take the pain meds. Then after that possibly has healed or changed or whatever, now you're almost at the addiction level of pain meds.
Right.
So are we really trying to replace pain meds with some alternatives such as medical marijuana?
Well, if you're going to look at just the condition of chronic pain and people being on pain pills and opiates and the whole opioid crisis, then that's a broad category. So somebody has pain, they're on pain pills, and they're not getting better. They're having side effects. Their doctors are increasing their dosages as they have been trained to do and learned to do. So if that doesn't work, I'll give you more. But patients are telling me who are using marijuana, Well, I was on all those drugs, and I wasn't getting any better. And I decided on my own, not stoner type of anything. They decided I wanted to try marijuana. These are, let's say somebody who's never used marijuana before, and they come, they want to use marijuana, and they come back and they say, you know what, my dosage is decreased. I'm not using those drugs at all. And I think one of the common things many people say is, I don't want to take those drugs. I just didn't want to do it. I heard too much bad stuff. But there's the stigma of marijuana. But some people don't really care about that. They just want to get better and they want to be healed. And that's what marijuana is.
You know what, though? I think that if people know that there are so many ways to ingest it, that, you know, if you stop thinking about, oh, I got to smoke that, no, you don't have to smoke that anymore.
Right.
So there's almost several or more so ways that you can ingest it, that it will make it even more, you know, comfortable for you to take that than versus the pills. Right.
So making choices for your health and healing always requires what's better, what's going to work, what's not going to work, how much does it cost. And with marijuana, you're going to probably want to look online. There's so many resources about marijuana, the strains, the dosing, the usage, because what I can't really tell you as a person or patient, I can tell you what's going to work for you. I can tell you the forms, usage, smoking, which is flower, various forms of flower, cannabis, sativa, indica, hybrids, strains, 8,300, probably more, from the original seed that God put on the planet. And then after that, you're going to say, well, I don't want to do that. I want to do edibles. I want to do infused products. I want to do oils. I want to do topicals. And then patients will decide for themselves what works.
You know, because really when you say it like that, they don't want to do edibles. They don't want to do smoking or whatever. They want to do tropicals. And that's like the cream.
Yes.
You can rub the cream on the
product.
And then, so I'm thinking that if you use those different methods and you're still working, you're still employed, that particular method, such as the tropical, when you know, rub it in your skin, somehow I don't understand why our system doesn't say, okay, well, this person has to use this product here, so we're not going to, you know, say their job is in jeopardy. The system is not ready yet to make a difference between what is good and what is bad.
They're not.
You know, so.
And I'll go back to political, because even though I stay on the medical side, I have to understand what's happening politically. And politically, you have a new administration, and legally, you have marijuana still being Schedule 1. So employers have to be careful. You have people driving trucks, you have people driving trains, you have people driving planes, you know, you all these. And so the industry that they're in has to protect not only their employees, but their passengers or customers, that industry. So testing for people who, you're applying for a new job, so they're probably going to test. Those industries will test. Then they'll do random testing. In addition, if there's an accident, they're going to do testing to see what's in your system. So drop in urine or blood test or whatever. At that point, let's say you weren't legal, but you could have been in the industry, didn't understand you, but you became legal after you got into the job. You best to be legal, because if something comes up, that's in your favor. It's still in your favor.
A little bit of a safety net.
A little bit of a safety net.
Yeah,
but if you're really at fault, nothing's in your favor.
But then, you know, who knows, okay, I'm working, everything's doing fine. All of a sudden, I have a condition that, you know, gives me chronic pain. I get the tropical. I'm going to rub it on my spine. I'm like, okay, this will make, and then it makes me feel better. Then all of a sudden, I know where the department says we're doing a drug test. I'm not thinking anything because I'm not smoking. I got this cream. Now, am I to let them know about this cream, or?
That's between you and your employer. So you're going you're going legal, and you're going with contracts that people have signed for their jobs. So I always ask my patients, does your employer know you use marijuana? Or they don't really care. I mean, I get all sorts. Or they tested when I came here, but they don't test now randomly, but if an accident comes up. But it's really a contractual and legal situation between you and your employer. So that's something
it's really touchy. It goes so deep that a lot of people are still trying to get around it, and you can't really get around it.
No.
But I'd rather know that if you are using a tropical cream.
It's topical.
Oh, tropical. Topical. She corrected me.
It's
okay. Okay. I don't know. Okay. So, but I'm glad you did. Okay. So it's
topical. So topical to be applied.
Topical.
Yeah, topical. And then the other.
So us in the hearing impaired world, we got it. Topical. Okay. All right. So.
All right.
So it's topical. Now that's the cream. All right, and then there's you can ingest it. Okay, so that
that's
means you're gonna
cookies,
eat.
brownies, gummies. I went to a conference. They have chefs who are making salsa, spaghetti sauce. It's so
Right.
many ways.
Now I've served the young lady make Kool-Aid.
Kool-Aid,
Okay,
right?
and
Juice.
now you said Kool-Aid. You know you cool with Kool-Aid. Okay, like I said. Kool-Aid?
Kool-Aid.
Okay.
Absolutely.
So that
Kool-Aid
big smile, that
yeah.
smile is bigger
Yeah.
than big now, okay?
And some CBD water. So we don't talk about CBD much, but that's the other part of the cannabis plant, or it's CBD, or hemp. Let's say it's hemp.
Okay.
And so if you have hemp-infused products with THC to activate it, those products are great too. And they have it in water too.
In water.
Yeah.
Where are we going?
Where are we going?
Okay, okay.
We're going up, and
I just
away.
had a clear glass, but I didn't tell you what was in it. So on that note, we'll be right back.
Of all the things you've done with your bike, donating it to Goodwill may be the most incredible of all. Your donations help fund job placement and training for people in your community, which means your stuff can be more powerful than you think. Goodwill. Donate stuff, create jobs.
And welcome back to the show. Now, those of you who are just not joining us, we have the returning doctor herself, Dr. Cynthia Shelby-Lane. And we're talking about, of course, medical marijuana at this time because we want to make sure that you guys, when you saw the first show, you probably had questions. And then one viewer did write in a question.
Okay.
And if I'm not mistaken, she wanted to know what's the difference between abusing medical marijuana and marijuana. Is there been a study or a search about both of them at the same time? Because some people feel like, well, I'm already smoking it. But now they're going to make it legal, and this part is medical, but this part isn't.
All right. So dispensary, first of all, anything can be abused. Anything. So if you have a medical reason to get a medical marijuana card, and for recommendation for medical marijuana use for your condition, that's a recommendation. There's no way after the fact that I can say I wrote your prescription for Tylenol 3, I said 3 times a day, and then you went off and abused it, or you're going to even abuse marijuana. That's called a cannabis use disorder. So there are people who do that, but there's no way for me to distinguish. I can tell you medical grade marijuana is probably a little bit higher quality because it has to go through testing. So it's not talking about abuse, you're talking about the quality of the marijuana. That's a different subject line. But people's personal lives, how they use marijuana, how they say they're going to do it, and 3 times a day or just at night, I can't police that either. But if you tell me you're using it 20 times a day, I'm probably wondering, maybe it's cannabis abuse or use, but there's no way to tell right now. There's studies, plenty of studies.
Right.
And we can talk about that in sort of a scientific realm in the future, because I know I'm going to come back.
You think? Okay. All right. Okay, that's a good one. So give us a shopping experience.
Okay. So you have your card, and you're going to go to a dispensary. And all dispensaries are different. They're situated in I'm medical provision only for patients and their caregivers who have a card. They've been licensed by the state of Michigan. I'm going to do Michigan because that's where we're from. And they can come into that sort of facility. Adult use facilities are a little bit different, but we don't have them here. There's 8 states that have recreational, but that's not the same thing. And then there may be centers where it's a wellness spa and a cannabis center together, and you come in and you get a mix and mingling of prevention and cannabis and buying cannabis and the whole wellness experience. We don't have that here either. So I'm
trying to figure out where that at. Okay.
So of those 3, the medical experience would be you enter a dispensary, and you're going to have to do some kind of legal things, at least for the dispensary that I'm with. Can't bring any weapons. You can't bring in your cell phone. You will be guided through a fingerprinting experience so that we know everything's legal. And then you wait, and there's video and water and munchies and all that kind of stuff. And then so that's a waiting area experience. Okay. And then you go into the dispensary experience, and that's where your homework and your research about the strains. I'll be doing OG, Gorilla Glue, Purple Onion, Purple Alien, all those different names. Well, what are those strains? Are they primarily indica, which is more relaxing and calm, or is it more sativa, or is it a hybrid of both? I looked up the research for my chronic pain, for my arthritis. I have patients 60, 70, 80. Well, I don't know what strain, and they'll ask me, but then they go for the experience, and that's when you enter the dispensary with the bud tenders. So we're not going to talk about that, but the experience is there for you to look at flower, to look at...
I hate to interrupt you, but what's a bud tender? Did I say that right?
You said bud tender, yeah.
Okay, bud tender. Okay,
so you went to your doctor's office. There's that waiting room experience, so just the waiting room like we had. But then you're going to get back on the backside of the retail experience now.
Okay.
So that's retail. The people in your doctor's offices are called nurses or medical assistants. For marijuana, they're called bud tenders, like a bud tender.
Okay.
Like a bartender. These are buds.
He's close. Okay. I went to the bud or I went to the bar. I don't know. I just went to the tender. Okay.
Yeah.
All right.
So those are the experts, so to speak, who can tell you what you can do and what they can't do, and because they're not medically trained and as like medical assistants, but they're there to know about strains of marijuana, about what works for perhaps your condition. And that's why you did the research at home, because you know, I have arthritis, I have bursitis, I have TMJ, I want something for my wrinkles. You know?
I mean, you know, there's a lot of things that seem like it relates to it, but ideally when you go through the crash course, so to speak, is to help you determine which method is best for you.
Right.
And that's good.
Yeah.
Now what if a person has a pulmonary condition like COPD?
Okay.
Can they ingest it, or they have to use something else?
That's always baffled me, because there's a CBD1 and CB2 receptors in where marijuana goes when you inhale and smoke. Some people can smoke marijuana and not have a problem, and they know they're smoking cigarettes, a pack, half a pack, pack and a half a day. I don't know why anybody's doing that in this day and age, but that still happens. So I have to warn them, like, you're smoking cigarettes, that's inflammation, inflammatory, you know, toxins, and you're putting marijuana in with that. And then your blood pressure, you told me you have hypertension, so I'm going to look at all preventative things for you. So you think you can knock off the cigarettes? Just knock them out.
I'm trying to figure out. Well, you know, I guess.
But I have to say it that way, because if you're gonna, if I put that package together, smoking cigarettes, you don't really think much about it. Your doctor already told you stop doing that. Here you are for marijuana, and I know what you're going to do, but you're going to smoke. You're not going to use edibles, shatter, dab, wax.
And you should, but you don't.
But maybe they can't. Maybe they have diabetes too with too much sugar. So they still want to smoke. That's what the effect is they want. So I said you have hypertension. Let me talk to you a little bit about your hypertension and what you could do in addition to marijuana being an alternative, prevention, treatment, in some realms sort of treatment. Let me tell you what you can do about your hypertension and your diabetes and other things. And so I get that all out of me for them in that setting. And so COPD, I think you shouldn't smoke, but let me tell you why. What is doing to your other conditions?
I mean, you know, it's like, to me, if you've got anything going along with the heart, you wouldn't, you know, smoke anything. But some people are like, well, I've always smoked cigarettes, now I don't smoke anymore. But the doctor said I can have medical marijuana. So you don't want to choose another method to ingest it because you're so used to having something between your fingers.
But people are willing. If I can talk to you and bring it up and show you why you might want to choose an alternative to smoking, even marijuana, they're more willing to listen. Maybe they didn't know what I know.
Well, of course. And I'm thinking, well, you know,
I don't know everything.
Right, well, you have anxieties and panic attacks, things like that. So, you know, to me, that would be one of the methods to help calm a person down, you know. Not that it's 100%, but if they have some form of medical marijuana, it can kind of like relax them to the point that they're not always so panicky. You know?
And that's an important point that you mentioned about anxiety, because they're not a friend, but a colleague of mine has done something called North Star Patients, and she has looked at usage. And I'm getting ready to do some data with all my patients now. And she looked, chronic pain is number one, anxiety and stress and back pain. So those are the top reasons for people getting certified in the state of Michigan. But if they're going to use any form of marijuana, anxiety is not included in this. I'm sorry. Anxiety is not included as one of the conditions in the state of Michigan for which you can get.
Wow.
But people are there for stress and anxiety. So I'm like, the only thing that really qualifies is PTSD. And so I have to stay within the legal bounds. So if you come to see me,
PTSD is
post-traumatic stress disorder.
Okay, you didn't think I knew that? Okay. Okay. After I messed up topical, I guess you said.
we're gonna spell this one out. Okay. All right. So yeah. So knowing what you're gonna do, the strains, your condition, and it helps.
Drink the Kool-Aid. Okay. All right.
If you want to.
Well, I'm not trying to make light of the subject, because I know, to have you come back is because there are viewers who are watching the show and saying, you know what, I'm thinking about getting this for my mom. Yes. So one of my dear friends told me the other day, she said, I said, ask her how was her mom. She said she's doing fine. She said, we just finished smoking. I said, excuse me? She said, well, I had to have her to eat, and so in order for her to eat, I just went on and gave her to her. And she says, she's 80 years old, and no one would believe that my mom smoked the joint so that she can eat. And I said, oh, okay. I said, she eating? She said, she eating up everything.
Yes.
So I don't want to encourage people to give their parents, marijuana just to eat, but that's one of the things that's helping them.
Right.
And I didn't think she was going to say smoke. I thought she might say she gave her a brownie or gave her a gummy bear or something. Oh, gave her some Kool-Aid. So I tell you what, ladies and gentlemen, I'm not smoking. I'm just having a good time with Dr. Lane.
That's right.
But we're going to take a break, and we'll be right back.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
And welcome back to the last half of the show, ladies and gentlemen. Now, I don't know about you, but of course I am very enlightened to see Dr. Cynthia Shelby-Lane again talk about medical marijuana and some of the things that you had questions about, which is, the bud tender for one, okay, and the different levels of it and things like that, and the legal administration, how we're at still war with it, but it's winning its way into the state of Michigan. So, if you have a question for Dr. Lane, the number's at the bottom of the screen, 1-800-323-5336, Twitter, #Marsha, and we're going to forward it to her. And also there's a number at the bottom of the screen for her as well. So on that note, now, Dr. Lane, somebody's like, okay, they're making fun of this, but even at my friend's level where her mom had to ingest it, her mother has cancer. So I understood when she said, she had to sit there and, make sure that she had the medical marijuana. But if a person can't go there themselves, the patient, how do they know, or who is the representative or the spokesperson to say, hey, my mom's 80-something years old, she can't come here, but she does have a card?
So in the state of Michigan, you can be certified yourself as a patient, and you can also get certification as a caregiver.
Okay.
Caregivers are people who are responsible for up to 5 patients, and they are allowed to provide those patients with a certain amount of marijuana. So if the person is an invalid at home, can't make it, can't drive, but just they don't even want to come to a dispensary, they can have a caregiver to handle that for them. Which begs the question is, what does the caregiver really know? And that goes back to the educational piece. So that's why I say, before you come to a dispensary, do a little bit of online work about strains and your condition and what you're trying to solve. I have to classify it as, I'm thinking strictly medical, I'm strictly thinking that you're trying to get better. So the more you can do in advance before coming into a dispensary, the better off you are. And then the bud tenders, what can they say to you? They can say, well, why are you here today? What is it you're trying to solve? Because they're not medically trained, as we spoke before, but they know what strains do what. They can guide you, they can help you, but they can't give you medical advice. And they can't tell you how you're going to respond to that. They can tell you other patients' possible responses, what this might do, but they can't tell you individually what's going to happen. And you're the best judge of that. So.
Okay. But, okay, so a quick question. Now, this is, to me, a matter of privacy.
Okay.
So you go into a facility, and there's the bud tender.
Yeah.
But there's several people in there.
Right.
I mean, what's the privacy level? Because each person don't want to just stand there and say, well, you know, I got this, and what can I take, what can I have? So is there any type of privacy, like one-on-one or?
Well, you're one-on-one with the bud tender, but you're earshot of the person next to you.
Right.
And so dispensaries aren't your usual doctor's office, all right? People they're having fun, music's playing, you've got Jamaica in the background.
Okay.
So what?
Did she say that? Okay.
But you have to understand, for me and my records, HIPAA compliance, so your records are private. But in that environment of a store, it's almost like being at CVS. You know, I got hemorrhoids. What do you have back there, pharmacist? And so people hear you, so it's earshot. But if you want to keep your conversation private, figure out what your words to use, which direction you're going in, so you don't have to tell everything. And in the environment I'm in, I don't think people are that shy about their health.
No. Well, no, I don't think you are either. When you realize that you have a condition that warrants that you may be terminal or the pain level is unbearable. So I think when you walk through the door, whether you're the loved one or caregiver or whatever, you're walking through that door for a very
important
meaningful and important experience so that you can have an idea. Because I mean, at the time my mom was living, there was some medication called Megace, and to get her appetite back, I had to give her a tablespoon twice a day, and next thing I know, she was eating up the house. But the medical marijuana wasn't even on the table then, and at that point, I knew my mother wouldn't have taken it. She definitely was not going to smoke anything, so to get it to her was going to be most difficult. But long story short, I'm just glad that now we do have a discussion about it, and a person like yourself always is welcome here to come in and update us on it.
I will.
All of it. Okay. So any changes, legislative wise, bud tender wise, all did I say bud tender wise?
Yeah. So I'm planning on putting together a website for advocacy, communication, education in the cannabis industry. Put group visits together. I do walk with the doc, and we will walk, not smoke. Okay. Walk with the doc. And
you said it. Okay.
And then we'll just have conversations, because I think people really do want to know. But there's so many educated people here in Michigan. You just don't realize it. They're brilliant. On the growing side, on the testing side, the dispensary side. It takes a village. It takes a village, and the weed guy may not be here much longer. So that's the legislative side.
They're gonna put a price tag on it in a minute.
That's right. So I just have to mention that, because it's all legal, and if we don't go to Washington and talk, we don't talk to our legislators and the people involved in advocacy groups, we won't get very far, and it's going to go back to the 70s.
You're right.
We talked about that before, remember?
Well, I tell you what, will you come back and see us again?
Absolutely. I'm going to Washington, and I'm going to go to Capitol Hill, and I will be the voice of the people.
Well, we'll wait for you. Okay. Well, ladies and gentlemen, as usual, I'm always enlightened to see Dr. Lane and many more of our guests come in and share some of their very important knowledge with you as well as myself. We're all being educated at the same time. So if you have a question, 1-800-323-5336, Twitter, hashtag, all that good stuff at the bottom of the screen, okay? So what do I always say? If you have a question about a person with a disability, or if you just have a general question, don't be afraid to ask. Just ask. I'm your host. Thank you.